Hello and welcome back to the press box here at IMSH 2026. I'm Sarah Lucero, your host today, and we are talking to some really great individuals that are working in the simulation healthcare industry. And right now we have a really wonderful speaker. We have Trenell Croskey with us. He is the Director of Continuing Education for SSH and IMSH. So big role. You've been with the organization now 5 years? Almost
5 years.
6?
I started April 2020, right at the start of the pandemic.
So you've had different roles.
I did. I started as the IMSH program coordinator. My whole role was originally making all the submission contents, get it launched, get it all sorted and off to the right people. And then in 2023, I was promoted to the Director of Continuing Education, overseeing the whole department and all of our educational offerings throughout the year.
Now, and here at the conference alone, you have, did I hear correctly, 900 different things going on?
We did. This year we accepted about 922 overall submissions out of a total of 1,670 that got submitted to us to present.
So what kinds of courses do you have going on outside of the conference hall?
So outside of the conference hall, you can see anything from our hands-on workshops, which are 60 minutes long, or panel presentations. We've also got what we call hot topics, which are rapid-fire 15-minute presentations on various topics, anywhere from educator, operations specialist, administrator topics, and researcher topics. And then we also have some more hands-on interactive things where you're getting to just work with mannequins, learn about moulage, which is the art of putting makeup on the mannequin and making it look more realistic, like they've been injured.
That's fascinating. So, and who comes to those courses? Is it nurses? Is it who would be doing maybe a makeup class?
So that can be, it's such a wide range with our us being an interprofessional society. We have some people who are one-person show, so they might be a nurse by training, but they're running their simulation program. We have some people who might come from a large facility, and so you have people who are specifically in operations who run the mannequins, do the moulage. We have people who could be emergency room physicians who help do trainings for other providers as well. So we're a completely interprofessional audience here, from research to administrators to operations people.
Now you get a lot of submissions, 1,600 submissions. Mm-hmm. This has got to be a full-time, year-round job to narrow it down and to choose them. Do you have a team of people working with you?
I do. So the Department of Education, we're a group of 4 individuals, but overall our call for content launches in April of every year, and we close it in June, and by the time September 1st rolls around, we have selected out of all of those 1,670 submissions, which 922 are going to make it into the final program.
Can anyone submit?
Anyone can submit.
How do you find out about that?
We launch our call for content every first week of April. You'll get it from the SSH channels. We put it on social media, across our website, and if you're subscribed to our emails, you get a notification when the call for content opens. Okay,
that's very interesting to know that. Yeah. Now, I do have to ask you, tell me about the beads. This is the Mardi Gras feel here.
Beads, it is Mardi Gras. So next year, IMSH is going to be in New Orleans. It's our first time back there since 2017, I think. So it's been a number of years, and we're very excited to be returning to New Orleans. It'll also be our final year in New Orleans. So if you didn't get to catch us there in 2017, make sure you get there in 2027.
2027, this time of year, same time of year next year.
Same time of year. We're going to be later January, towards the end next year.
Okay, wonderful, wonderful stuff. Now, there's so much going on now. As we're wrapping up at IMSH 2026, what are some of your key takeaways from this event?
I mean, I think overall you can really feel the energy, and so that no matter which role you do in healthcare simulation, everyone here is passionate about what they do, and overall our goal is patient safety. So we're improving healthcare outcomes, and you can just really feel the energy here on the exhibit hall floor and throughout the rest of the convention center of how excited people are. So how will you integrate these takeaways at SSH with your role as Continuing Education Director? So Each year, we always try and make IMSH better and better. We look at every course afterwards and look at all the evaluation and see which courses were really popular. I know this year, for example, we got a lot of AI content, and all of those courses completely sold out. So that tells me throughout the next year, we're going to put more virtual content out there about AI as well. For anyone who wasn't able to make it to our in-person meeting, we know that that is a hot topic right now, so that's something we will continue to offer content on for the next year.
Now, how did you get into SIM?
I got into SIM by happen chance. I happened to be working at a hospital at the time, and I saw a position opening for the SIM lab, and I did not know what the SIM lab was. So I applied, and I told them during my interview, like, even if I don't get this job, this just sounds very fascinating, and I'd love a tour. But luckily, I did get the job, and I never looked back.
And here you are. How many years has it been now?
My first job in SIM started in 2011. So been well over 10 plus years now working in simulation.
That's amazing, amazing stuff. But continuing education, you do offer a lot of things outside of IMSH.
We
do. Year-round?
We do. We have year-round content. So IMSH is our big in-person January event. We have a SimOps, which is just for our operations specialists. That happens every July. And then we offer virtual content throughout the year. March through December, we do weekly webinars on different simulation topics. We offer cohort education for anyone who's interested in accreditation or certification, and you want to work with a group of individuals also interested in that same topic. We will pair you up in a cohort model and have you all train for your certification testing.
So much going on. You wear a lot of hats under the education umbrella. So thank you for what you do, and of course, you know, the event is wrapping up here in San Antonio, but what's the feedback that you get from people attending the different education seminars?
Feedback I've gotten so far is everyone has been loving what they have participated in so far, and they wish that IMSH, they had more time to go to more courses because we had so much great content out there. You really do have to pick and choose which content you're going to go and see with your free time.
So if you want to be part of IMSH or SSH somehow in the future, it's time to submit very soon if you want to be part of next year's conference.
Yes, our call for content for IMSH 2027 opens in April, first week of April.
All right. Trenell, Croskey, thank you so much for joining us, Director of Continuing Education.
Yeah, so happy to be here.
Yes, thank you.
Thank you.
And thank you all for watching.